Salina Regional Endocrinology earns the American Diabetes Association Diabetic Education Recognition Certificate. Leslie Mack and Lindsay Elder with Salina Regional Endocrinology join me today. Ladies, thank you so much for being on the show. Leslie, let's start out talking about the impact of diabetes.
Oh, the impact is huge. I just looked at the statistics today from the Centers for Disease Control. There are 37 million people in the United States living with diabetes, or 11.3% of the whole population. 28 million of those people know that they have diabetes. The other 8.5 million aren't diagnosed yet.
Let's talk about the importance of diabetic education as you go through.
Yeah, Mike, I think that's a great topic, and that's what I do. I'm the diabetes educator over at the clinic, and diabetes education is really the foundation of living with diabetes, because the person with diabetes is responsible for about 95 to 99% of their treatment and their self-care, and they have to know what they're doing to take care of their diabetes and the factors that will affect their blood sugar, and then how to respond to those different variables.
So obviously you guys are with the Salina Regional Endocrinology Clinic. You probably don't see every diabetic patient because a lot of them are handled by their primary care, exactly. But you've got a great source for the education. When should people kind of look at the education aspect of diabetes?
Well, there's 4 key times that it's sort of recommended that people who have diabetes look into getting some diabetes education. So that would be at the time of diagnosis. So that's a really key time. The second time is if their treatment changes. Like, for example, someone's going from oral medication to an injectable, or an injectable to insulin, or insulin to an insulin pump. So something major changes in their treatment. The other thing, a third one, has to do with, has their life changed? Like, has a new health complication developed? Has their, now they have cancer in addition to diabetes. And so that's a whole nother area. And so we need to educate people about that as well. And then the fourth and final time that it's recommended is if their living situation changes. So maybe going from living at home and now they're living with a child, an adult child, or maybe they're going into assisted living. And so that's another key time for people to get diabetes education. And that's with us at Salina Regional Endocrinology or any other diabetes education program in the area.
Thank you so much for some great information and for coming on the show. And thank you for watching. For more information, visit salinaregionalendocrinology.com.